This is the Men's Room Podcast, where relief is your duty and your innate self is welcome. I'm your host, as always, Ish Mendoza, and I'm psyched that you stopped by. What an episode we have in store for you all today. I am incredibly encouraged by the conversation that I had with licensed marriage and family therapist Luis Abbott, who discusses therapy and mental health and shares his insights on a number of topics, including psychedelics and mending and everything in between. And you are not going to want to miss out on the things that we talked about. It could have easily been a 3 or 4 hour plus conversation, but we got to the heart of things. So check it out. And I just wanted to make mention at the top here that any of the topics that we are discussing today is not intended to be used for any legal reasons or any therapeutic reasons for that matter, but simply a conversation around such topics. And so therefore, please listen at your own discretion. I want to encourage you all to find out more information about Luis's practice and everything he's got going on. That is available at abbotpsych.com. That's ABBOTTPSYCH.com. And without further ado, let's get into it. Yeah, normally from the nature of your kind of work, you don't want to be mindful of anything that needs to be omitted or amended. But also, I hope you don't consider this like me in an attempt for free therapy session.
No, it's all good.
Because mainly I don't want it to be necessarily about you being a kind of a mental health professional and being in this space. I didn't want to make it seem like there's I want to actually talk about the subject of mental health and kind of also just you the person and stuff too, so we can kind of leave it at that.
Most definitely.
Typically what I found is that usually what happens is during the podcast there's like formalities of like feeling a little like stiff and uncomfortable and stuff, but around minute 5 or whatever people
start loosening it up.
And the same thing, and alcohol helps,
Oh yeah, for sure. Yeah, there's this psychologist. His name's Dr. Carl Hart, and he has a different perspective on drugs. It's pretty interesting because he does heroin, but he like sniffs heroin, but like he kind of does it like he doesn't like overdo it, but like he kind of does it in a way of like what he said. It's like makes him feel more compassionate, makes him feel more like loving and all that. So he comes from a place that all drugs are not bad. You know what I mean? Like it's just in a way how people use it and cope with, like how they're coping and why they use it. And I think a lot of people just use it as a distraction and coping skill, and that's where addiction happens. Because you're relying on something to like you're trying to avoid and not want to deal with. So like drugs in itself is not bad. It's just how you use it and all that. And so he comes from that perspective. So he's like done everything. He's done like meth. He doesn't but he's like not addicted to anything. Yeah, it's an interesting point because I wonder like somebody that doesn't have an addictive personality, like how that manifests in that way too. Because I mean, also non-substances can be very addictive as well. Netflix can be addicting. Anything can turn into a coping skill. So.
Yeah, I was curious about like how that has come about from. So I listened to your story on one of the podcasts, the Therapy House podcast, and I was curious about like. We can dive in as detailed or as
we can go deep on it.
But yeah, I'm more so curious for my own personal sake to see how that's done, and also seeing what the benefits are of like psychotherapy and psychedelics and things like that as a means to your point, to not fill a void but maybe explore that kind of stuff. But I want to backtrack a little bit. So typically what I do is anybody that's on the podcast, I want to like get to like the depths of who they are. And so like I mentioned, this is conversational about like you, the person, that I want to kind of dig into and But who are you, like in a nutshell? Characteristics, your family structure and things like that too.
Yeah. Surface level, we'll start with that. Yeah, so I'm 37 years old. I live in Rockland, California. I'm married to Melissa, and I have a kid. Her name's Luna Blue. She's 1.5. She's my pride and joy. I love her a lot, man. And yeah, yeah, that's always hard to question that, like to answer. It's like, who are you? You know, and but I don't know. I was thinking about that on the way over here, and I don't know. Like when I'm talking, explaining myself to someone, you go about like your personality. So like I'm more like I feel like I'm a more like introvert, extrovert type of person. I love talking to people. That's why I'm in this profession as a therapist. I love talking to people. I love hearing their stories and just connecting with people. And some people feel like, for example, like my wife is a person where she hates small talk. Like she hates that. Like she can't get into that. Like she wants to go deep and have like a really like good connection with someone. So she avoids all that. So her circle of friends are kind of small because of that. But for me, like I can just talk to anyone. I can go, like I can be at a bar or be at a restaurant and just start like talking with someone and just shoot the shit with people, So that, to me, that's cool with me. But then there's times with me then where I'm like, I need a retreat. I need to like, and one of my favorite things is like, I like being alone. I love kind of being alone. I go to the movies alone. And a lot of, you tell people that and they're like, what do? You go to the movies alone? And I'm like, man, that's my favorite thing to do. I like just go watch a movie and just be with myself, And I've always been that type of person of kind of just being with myself. And, as a young teenager, I would just go on long drives all the time and just kind of just listen to music and just try to find different spots and different places. That's always been me, It's interesting. I was talking to my wife about like some of the stuff about me where I come from, my family and all that. And, a lot of us, we're all shaped and molded by our own family dynamic and family system, And so I think I'm a pretty contemplative, kind of reflective person. I can get in those modes at times, but I feel at times I can have like really little highs and how I react to things, how I deal with things. Like sometimes I can be like a hothead at times, and like I know that's been a struggle with me at times and trying to like work on that, because I feel like growing up, my mom was a very, very intense person. Like she was very reactive, and it was hard to really talk to her at times, because she was just, everything, she's right in everything, and like it was hard for her to apologize on things, and like her way of like handling conflict was like just yelling and like really intense conflict. So I can see myself in that at times where I can get like, we're in a conflict where I can just get really reactive or high at times. But then I'm kind of like my father at times too, where my father is very, he's a quiet man. He doesn't say a lot. And when he says something, it's like something you want to listen to. But pretty much he's kind of just chills by himself, doesn't say much when people are around. I feel like my dad had like some undiagnosed kind of depression. So that could come up in me and sometimes too, of like just the lows or just like really kind of just retreat within my own self. So I have those kind of two aspects of myself. But yeah, like I'm a fun kind of like outgoing dude, pretty chill at times. It's interesting having now as being a father and having a kid, man, sometimes like change and adjustment, because that's what kid is. Like you have to adjust, you have to change, you have like to, so it's like, so for me, like I'm finding myself, like I've always kind of prided myself and like, yeah, I'm a chill guy, easygoing person. But now as a father, I'm feeling like I'm more like tense and stressed. And when things change, I'm just like, oh God, like, so it's kind of hard in that sense and like trying to work on myself on that. But yeah, like, pretty much, yeah, I think that's kind of like some of my personality. Yeah, for sure.
Yeah, that's probably the most descriptive I've ever. So, you've probably been in a place where you ask a lot of people. I'm sure you have a way that you hope that people respond to you, or it's like a clear picture.
Yeah.
So I appreciate you digging into that. How do you feel fatherhood? So I can tell you from my perspective. I was thinking about it today because I took a personality assessment test, probably about 6 or 7 years ago, that I was like digging up in an old email.
Yeah.
And I saw that my results were like off the charts patience. And I was like, that was like my, I still feel I'm an empathetic person, but like patience was like, really, really high. And I was like, well, damn, this probably shifted and
Yeah.
being a parent.
Yeah.
Because like I feel exactly that. At times my patience is really really running low.
Oh yeah.
And I feel bad as a result. That's there's the trope of like grumpy dads.
Mm-hmm.
And I always hate that because I felt like my dad's he's a grumpy guy too. And I feel like my age is showing through a lot in the way I got a short fuse at times and stuff.
Yeah.
But it's mostly with the kids and not so much with other people. There's something that's something I want to work on for sure.
Yeah.
But from your perspective, what is there anything specifically that you've been able to identify in yourself that has changed being a dad?
Yeah, I think for me, yeah, like I understand where you're coming from about the impatience and like, but I feel like when having a daughter, it's like, man, like just really feeling just, I don't know. I think I'm more into like more of my emotions for sure and feelings and kind of the vulnerability factor of like having a kid. Like, I think like, because you think you're cool, but then when you're then like when your kid does something, you're like, I'm so uncool, you know what I mean? Like, so it's like, it's a humbling experience too of like having a kid. So, feel like really humbled. I feel changed in that sense. Yeah, I just feel like more just, I don't know. I feel like a lot more love for sure. Like the openness in my heart, openness of my own spirit towards life. I think it shifts a different perspective on life. I feel like you start thinking about things more like, I was talking to you earlier about like, yeah, like you start thinking about things that like you don't think about when you're single and don't have a kid, like, yeah, I want to be around family because family is super important. I want my kid to be around that. Like as, single young men, we're just like, no, I'm just going to do my thing. I'm going to travel. I'm going to go and like live different places and just do these things. So I think like, and even also like the aspect of like where I want to live, like I know I lived in the Bay Area most of my whole life, but like the Bay Area is just like getting bad now. You know what I mean? It's super expensive. It's like, man, like it's, just a lot of crime, a lot of homelessness, and like start thinking about those things. You're like, I don't want my daughter to kind of like her world to be shaped by that. Like I want to go to a place where it's like family oriented. I want to see kids playing out in the playgrounds in the neighborhood, having fun. So like even those things. So like that was like where we live right now is kind of, we base our decision and choice on that, because now we live there and it's very like family oriented, friendly. The neighbors are nice. The kids are like cool. You see kids playing all the time. So like, just like those things, like those kind of perspectives of life. I think like even me personally, like just taking care of myself more, like I remember when, Luna, like when we found out Mel was pregnant, like something like immediately shifted. I'm like, I gotta like dial this in.
Yeah.
You know what I mean? I gotta dial this in. I gotta dial in with my health. I gotta dial in with my exercise. Gotta dial in with like, yeah, just those type of things because I want to live long. I want to be around. I want to be mobile. Like so I started going to the gym for the like, yeah, I've always been a runner. And so, but I've never went to the gym. So like just thinking about like the future, I'm like, yeah, like I want to be more mobile. I want to have muscle. I want to be strong. Like I want to be able to like run around and like not be winded and all these things like that. So, so just like those things, those shifts in perspective, shifts in like behavior, really like started kind of becoming more important to me in those aspects.
Yeah. It's thinking about like I always think about like the mindset of having a legacy or like being an extension of yourself through your the next generation of your offspring,
Yeah.
That's super important because that's kind of molding the way you're thinking about the future. And to be quite honest, when I was in my early 20s, late 20s and all of this stuff, when I was really not I was living in the moment, thinking about myself, and not really worried about what that meant. And I was like not being in a place where I wanted to be like settled down for the most part too, like you go through moments in your life, but not putting yourself into a perspective of like thinking about anybody but yourself. No, I wanted to kind of dig into your profession a little bit and talk about number one, why you decided to choose that as sort of a career path, and how does that look like, for someone maybe that's in a formidable time of their life that's thinking about like potentially like pursuing something in the mental health space as a career. And what did that look like for you? Yeah,
it's interesting. Yeah. I always tell people this, like, I feel like kind of the influence of like why I wanted to get into therapy is, I think part of it is my dad. My dad's a clinical and forensic psychologist. So kind of just seen, from a kid, my dad he used to do more clinical work when I was younger, probably like around like 5, 6 years old. He worked at this place. It's no longer in San Jose, but it's called Geretto Institute, and he worked with like sexually abused kids. And so it was pretty intense. So like I remember times where he would be like watching these, like it was VHS tapes of these interviews of these kids, and I would hear it, and it was just like saying the most like graphic things, you know what I mean? And I'm just like, I don't know how you can do that, So, but he continued with that, and like now he does more like expert witness stuff where he'll go and evaluate, and he still works with like kind of like, well, not in the sexually abused kids, but he works with like the sexual violent predators.
Okay.
So he does like evaluations. He'll go to like state mental hospitals, prisons, and like evaluate people that are in there that, sexual violent predators. So, and then he'll go and testify in court, like whether they're trying to like get out. So it's interesting. Like he's more like the perspective of like, I wouldn't say he's on their side, but like from his research and stuff, like there's a point where like, because the problem I think of people fear is like they're going to reoffend again, And so like these men are probably like in their 70s, 80s. And so from like his research, like basically they're not going to really reoffend based on like their age and like testosterone levels and things that go down and the sexual drive and all that stuff. So, but they want to lock these guys forever, which I understand and get. Like you don't want these people to go in, but go out into society again.
He looks at that through the lens of like from a therapist's perspective.
Yeah, a psychologist. Yeah, psychologist perspective. So, so he's helped people get out, and like they haven't reoffended again, but like. So he's kind of like empathetic towards these people at times. And I think like, he gets a lot of slack over that, because like, just based on his research and science and evidence, it shows that, but I think he deals with a lot of like state psychologists that like want to keep these people in, in these state mental hospitals forever. But so he does that work. So I think there's a kind of part of it that I got influenced by that, by, psychology. And, but then I think, I mean, I grew up in church. We grew up in the kind of the same type of like, apostolic, so, so I was really super involved in church. I was super involved in the youth group. I was a youth leader, and I dealt with a lot of young people, so, and I would hear a lot of their stories. I would hear a lot of their struggles and challenges they're going through. I would hear a lot about depression. I would hear a lot about suicide, suicidal ideation, self-harm. So I would just kind of be like a supportive presence for them, in that way, and kind of give them some spiritual guidance. But like, I think that's limited in its way, because, you can only go so far and say, oh, just pray and read the Bible. Like that's good, I think, but like, that's not all of it. So my help and my support was very limited. And so, but I wasn't even thinking about getting into like psychology or therapy. I wanted to get into the medical field. So I went to my undergrad. I wanted to be an anesthesiologist. And so I started taking the biology classes. I remember my first semester and sitting in a biology class, we're learning about the cell and cell membranes and all that. And I was like, this is so freaking boring, dude. Like, I hate this class. I don't want to be here. Yeah. So I was just like, I can't do this. So I was like, I had to think about like what always interested me in like high school. And it was always like either sociology or psychology. That always interested me. I loved like reading books on sociology, psychology, just really hearing about all the different studies that, those famous studies that are out there in psychology, learning like, your kind of like psychology courses and all that. So, then I decided I changed my major, and then I went into a major in psychology. And so I did my undergrad, I did all that. And then right after, that's when I kind of decided like I wanted to be a therapist, because I feel like, in the church, like I was really, like I like to serve. I like wanted to help people. I wanted to be there for young people and like kind of counsel them and help them. So I was like, I want to do this for a career. I want to help people. I want to like be able to like see people, like help support people, help people through their problems and issues. And then at the other point, it's being fulfilling for me too. Like I'm like every day I get to like help people. So I went into my master's program. I went to this grad school called Palo Alto University. Did my 2.5 years there, and then usually like the first year is all like clinical work. So you're learning all this stuff about clinical, like psychology, therapy. And then your second year, you do what is called a practicum. So you go to a site, and that's when you start kind of getting into therapy. Because, and that's why I always tell people, it's like, you can learn all like the book knowledge, but it's only until you start getting into the work. That's when you really start learning. So
is that considered clinical work, or is that something different?
Oh, the practicum?
Yeah.
Yeah. That's more clinical work for sure. So you do that for about a year. So what you do is like, they used to have like a kind of a practicum fair. So, so there's all these like different like agencies that come, and you get to go to all their different like tables and kind of see what, like what they're doing and like kind of work they're doing. And so I found this one agency. It's called Starlight Community Services. So that's where I started. It's a community mental health agency. And so what I first started was the juvenile justice department. So I worked with kids, like young kids that were coming out of juvenile hall on probation. And then also there was an intersect of social services. So working with kids that are in the foster care system, adoption and all that. So man, I got thrown into the fire right away. You know what I mean? And so I remember my first client was a kid that was trying to stab his mom.
Oh shit.
And so that was like that was my first client ever, dude. And that was pretty intense. But so I would go to juvenile hall and kind of like counsel kids there and do therapy. Or usually what community mental health is like, a lot of it is not even in the office or a therapy room. It's all in the community. So you can do therapy at a park, you can do therapy at their home, you can do a therapy at Starbucks, like whatever. So it's kind of like you'll do whatever to help these kids. So you meet them where they're at. And so
is that, would you say that's more helpful? I mean, to be in a non like threatening kind of environment?
Yeah, I think so. I think especially with kids, you know what I mean? I think like, teenagers sometimes can be intimidated in a therapy room. And so kind of just meeting them where they're comfortable at, they can open up more and kind of let down the defense walls and all that. So, I worked in that program for about a little over a year. And then they hired me even before I graduated. So they hired me there. And then shortly after, I went to this other program there in the agency. It was called IOP. It's called Intensive Outpatient. And so that's where we dealt more with trauma. And that's where I found like really my niche in therapy. So I'm trained in different trauma models. So kind of that's where it started there. So we work with all these different traumas: physical, sexual abuse, emotional abuse. Like I remember working with a kid that his uncle got shot by the police. And so like I had to work with them on that and the whole family. So it's not only just the child, but would also work with the parents too. So I would do family therapy, I would do individual therapy, or sometimes I would do one-on-ones with the parents. So I worked in that program for almost like maybe about 2.5 years. And then eventually I just wanted to like work with a different population. And then I kind of decided, I was like, I want to do something that's like challenging. Like, and so I started working with eating disorders, and that's how I got into eating disorders around like 2019. I worked at this kind of inpatient program. It was called the Lotus Collaborative. And it was an eating disorder clinic where they had different levels of care, where they had what is called intensive outpatient. And then another high level of care is called partial hospitalization, PHP. So clients would come in. Some people would stay all day. So let's say they're about 6 to 8 hours. So that's PHP. And then IOP was about between like 3 or 4 hours.
What prompts somebody to come into a program like that? Was that voluntary, or was it out of a necessity, like from a medical standpoint?
It was both. Yeah, it was both. I think we got a lot of teenagers. So it was like a mixture of like teenagers, adults. I think the oldest that we had there was about 80 years old. Oh. And so so some were voluntary, some were especially teenagers are forced to be there. So it would be like, I would do individual therapy with some of these clients. And then also as part of the program, so I would do like group therapy. We also had there's an aspect too of like eating disorder treatment, like these kind of like inpatient like treatment centers where you sit down and eat with them too. And so because that's so challenging for them to like eat, so you just had to be a support there. And like that, I think that was like really the hardest part of it, because you would just see like people just break down. Like you would see them just like lose their shit, cry, throw tantrums in a way. because they didn't want to eat, because, you know, to them, like eating, it was such a like suffering for them, you know what I mean? Because, you know, for them, they have this concept of like, if I'm going to eat, just going to gain all this weight. I'm going to get fat. I'm going to get ugly. So we had to support them through those times. And so it would be jarring for other clients there to see that. But so that was kind of intense, that program. And then, so I worked there for about a little over 2 years. And then eventually I went, that's when I was telling you, I moved to Austin, Texas for a while. So I was doing more online therapy. So I was still working. I had some clients actually that followed me there, and still I see some clients from there, from that program.
How do you, sorry to interrupt.
Yeah, no.
How do you like become to like specialize in the group or to get additional training? Is there like a level of like additional certifications that correlate with that, or how does that become a specialty?
Yeah, it's interesting, especially with eating disorders, because eating disorders has one of the most highest mortality rates in any mental health issue.
Really?
And so, but the unfortunate thing about that is like you don't learn much about it in your grad program. So you learn, like the basics is like depression, anxiety, trauma. But they don't really touch on eating disorders, which is so unfortunate. That they should be touching on that, because it's such a huge issue, and it's such a like fatal issue, such a fragile issue. And I think grad programs need, especially like, therapy grad programs need to really focus on that, and like, I'm a big proponent of that, because, I've been working in the eating disorders for, almost like 5 years now. And so, so there's really no certifications. Like, it's basically, if you get into a program like that or start working at a place like that, and that's where you get your specialization there.
I got you.
And having that as a therapist really opens up more doors too, because it's very rare to find a therapist that specializes in eating disorders.
Can we dig into that a little bit more too?
Yeah.
I'm curious about just like what constitutes an eating disorder and like the different types of it. I mean, obviously that there's the quote unquote popular ones, bulimia, anorexia, and things like that.
Mm-hmm.
Overeating, is it also a disorder, or how does that like fall in line, or what types of disorders are considered an eating disorder? Yeah,
so you kind of mentioned already, it's like anorexia nervosa. So that's more of like, there's kind of different types. So like the anorexia, like the specifiers, like restrictive type. So that's more like where they're not eating at all, or they're eating very little. They restrict a lot of food. There's that fear of gaining weight. There's just like body image issues, calorie counting, body checking, those type of things. And so that's more of like, and then there's the other one is the anorexia purging type. So that's where they use, that's where you throw up. Okay. So like people, will eat and then throw up. But all the rest of the other specifiers I said are the same. So that's anorexia nervosa, and then you got bulimia nervosa. That's a mixture of binge eating and also finding ways to like purge that. So meaning you can use, restrictive, you can use restriction, you can use like over exercise, you can use purging. So that's kind of like the difference between anorexia and bulimia. There's a binging aspect of it. So that's more of the overeating, and then what you're talking about, the overeating, I wouldn't, people do overeat, but there has to be a specific criteria that meets what is called binge eating disorder. And so binge eating disorder is basically where you're eating a large quantity of food within one sitting, within the DSM. It's called the Diagnostic Statistical Manual Mental Disorder. So that's kind of like our Bible in a way as therapists to use. So it's kind of like shows all the different diagnoses and mental health issues. But within that, the DSM-5, it's like, so you're eating a large quantity of food in one sitting within a 2-hour period. And then the other aspect of it is like eating until you're uncomfortably full. Where the point you're sick in your stomach, you feel like you're out of control as you can't stop, you binge when you're not hungry, and then there's an aspect of like feeling shame and guilt afterwards. So that's kind of the criteria for binge eating disorder. And then there's some other ones that are out there where they haven't put it in the DSM yet, but they're kind of thinking about maybe in the next edition they're going to put in. So there's one that's called diabulimia, and so that is like bulimia, so where the binge eating and restriction or trying to purge out the calories, but also there's an aspect, a lot of these individuals have diabetes. Okay. And so what they do is they won't take their insulin because they think they're going to gain weight or they're going to get fat. And so that's a very deadly one. I remember we had a client come in when I was working at that inpatient program where she had diabulimia, and it was so bad that she came in. She looked orange.
Wow.
Yeah, so it can get to that point where it's like, yeah.
Was her name Donald Trump? Just kidding.
But yeah. So there's that one, diabulimia, and then there's the other one called orthorexia. And so orthorexia is, I think it could get confusing because in our society we really put an emphasis on like healthy eating, healthy lifestyle. But this gets to a point where it becomes too obsessive over it. You become like, we're at a point where like you're just all about like the types of food you're eating. It has to be clean, organic, no like processed foods, and then also it's like some aspects of it where people will not go to like different parties or events because they'll find out and say, well, what type of food they're going to have. And then they find out it's like not whatever quote unquote healthy food. They just won't go. And so then that starts disrupting their own like social functioning, social connections, because they're so anxiety ridden over what's going to be there. So it gets to a point where it just becomes too obsessive, where it starts disrupting different types of functions in your life, whether it be work, your social life, your family. And that's kind of a lot of like mental health disorders is like, people can be sad. We're all sad at times, or we get anxious about things. But it gets to a point where it starts becoming more, detrimental to your own mental health. It starts affecting different areas of your life, where it starts affecting your work, starts affecting your family, your social functioning, like your day-to-day life. And that's where, a lot of the DSM you find and read is those aspects of it. There's always that specifiers, like, does it disrupt this type of like functioning in your life?
I got it. And so that's kind of where it becomes more of a necessity for including a professional kind of in that. Because, I mean, hearing that, I hear parallels to like people I've interacted with before. Like it's kind of a stereotypical like vegan mentality, like a vegan will show up and just kind of like put their out there, like, like, oh, there's no vegan options, and they got to like, it's almost like a religion for them too, But thinking about that and figuring out where the lines are, merged into it being an actual disorder of sorts. And so it's an interesting point that I'm curious about, like where it becomes, because to be honest, I think with maybe the advent of the like the internet, self-help and all these other things, I'm curious about where people get into like this kind of a cycle of self-diagnosis in a lot of ways. I alluded to it earlier when I said, oh, my OCD is bothering me because of this, but like something to that effect of like, have you encountered that a lot lately? I mean, to be honest, like, it's a good thing, but the awareness of like mental health and people being aware of that kind of stuff is it's always a good thing that they're mindful of that, but it's kind of a trendy thing. And I wonder if people like go to the extremes of like self-diagnosis in a way that's not like really, or how are you able to differentiate that stuff if necessary?
Yeah, it's interesting because I think, especially, working at an inpatient program, like I've got to like, there's always these subcultures within our society, and within inpatient programs, it is a subculture within it. And a lot of these, like, especially like teenagers, a lot of them have grown up within like being institutionalized, being hospitalized, going in and out of being hospitals because they got, suicidal ideation, self-harm. And then also, and then they go to different program after program. And so they kind of grow up. It's almost like they grow up institutionalized in a way. Yeah. And all their friends, all their social connections are within, the inpatient programs and hospitals and stuff like that. And it's so interesting. Like that really opened my eyes. I'm like, hey man, that's all they know, especially in their teenage years, that's all they know. And then when they get into the real world, it's like they're so like, anxious, and they don't know how to talk to people. They don't know how to be, or sometimes they'll trauma dump on people, like a way of connection. And those people will be like, whoa, what are you doing? Like, tell me about all your trauma. And so like, but I think also there's an aspect also that within this subculture is they really wear their mental health diagnosis as a badge. Yeah. It's like this thing that they're proud of. And they're always, in a way, self-diagnosing all the time. They're like, well, I got anxiety, I got depression, I got trauma, I got OCD. And a lot of times they don't have that. You know, they don't have all these diagnoses. You know, they may be having some aspects of it, but they're not fully diagnosed with that. So yeah, I think there's an aspect of that. And I think just within people, I think, you know, like you said, with the advent of the internet and, you know, Google and all that, and, you know, they may be struggling with something and then they look it up. They're like, yep, I have OCD. Yep, I have depression. Yeah, I have anxiety. But no, they don't really know really. Yeah, they may have some aspects of it, but no, it's not.
Yeah, I mean, it's interesting because like you're right. I think it bleeds into the social media generation of a lot of people. Like, yeah, I mean, it's hard to not, because there's a correlation with like getting another additional level of sympathy,
yeah,
and attention. You know,
yeah.
that comes along with that too. So it's hard to, like, you know, I'm sure that that in itself is probably something that still, like, there's a necessity for somebody to be heard in that way too.
Yeah.
So speaking along those lines, I'm curious about, you know, the way that that therapy. So number one, in my ignorance, part of my ignorance, but can you talk about the differences between counseling and therapy? I'm still kind of unfamiliar because I've heard both terms.
Yeah.
And maybe as it relates to, I know that kind of listening to your podcast, I've discovered, and I think from other people that I've known as well, there's an associate pathway that one has to get into their. So your official title is licensed marriage and family therapist.
Yeah,
right?
licensed marriage and family therapist. Yeah.
And before that, in order to meet the criteria to beat that point or be at that point, how does that? What do you have to do for
yeah, so like what I was mentioning earlier, like the practicum part, like when you do your last year, you go to a site and start doing some clinical work. So your title is kind of considered therapist in training. So a marriage, it depends because there's all these different titles. There's marriage family therapist, and then there's licensed social clinical worker, and then there's also licensed professional clinical counselor. So all these different titles, and
a lot of acronyms.
Yeah, there's a lot of acronyms. So they're all kind of like different in some ways, but everyone's doing therapy. But it's just the different like tracks that they're on in regards to their education and like licensing, really different. So for like if you're a marriage family therapist, your clinical hours are towards your licensure to get licensed. You can start counting them once you're in that practicum part. So you can start counting your hours towards your license. But with a licensed clinical social worker, they start, you know, accruing their hours towards licensure after when they graduate. And that's the same thing with also the licensed professional clinical counselor, that when they do their practicum, their hours don't count. So only kind of therapist or like therapy track that you can start counting your hours before you become out of your grad program is only licensed marriage family therapist. So the process is where you're licensed kind of therapist, not licensed, trainee in therapy when you're doing your clinical work in grad school. And then once you graduate, you kind of up yourself to what is called an associate marriage family therapist. So that's your title saying like, hey, I'm a person that's just doing therapy, but I'm on track to get my license. And so you have to accrue 3,000 hours before you become licensed. And so once you kind of accrue those hours of 3,000 hours, then you submit it to this place. Well, it's different in every state, but in California, it's called the California Board of Behavioral Sciences. Okay. That's in Sacramento, their headquarters. So once you're done with all your hours, you have to like submit all your hours to them. They go over everything to see if you did everything according to their kind of guidelines for you to become to take the test. So if they kind of approve everything, so then after that you go and take the license clinical test, and that's a test that's like 4 hours, and it's like over like 180 questions. And so if you pass that, then that's when you become a licensed marriage family therapist, and so that kind of gives you the kind of the street cred of being able to like do therapy, and then also you can open your private practice too.
And can you in turn be the licensed person? Because from my understanding, an AMFT has to be under the supervision of an LMFT.
Yeah.
Is that how it
works? Yeah. So so some licensed therapists are what are called clinical supervisors. So you, as you're an associate marriage family therapist, kind of like to solidify you or to like allow you to do therapy in that title, you have to work under someone that under their license. And so that can be tricky too, because sometimes like if you if you fuck up as a therapist, then they're liable because
okay.
they're taking
on the
care.
hook,
Yeah,
yep.
they're taking care of you. So they're liable. So that's why you have to be super careful in that stage.
So are you at the point where you can kind of have somebody under your wing, or?
Yeah. I'm doing right now at Kaiser. We're working at. I'm actually a clinical supervisor for. I barely started that, so about a month ago I started. So so I have someone under me right now.
Okay,
Yeah.
nice. So shifting gears a little bit, I want to talk about I'm going to talk the business side of things. You know, being in, so you under the clinical supervisor and things like that, kind of operating under an organization, but also having the ability to be an entrepreneur and work for yourself in a lot of ways. Two-part question. Number one, how does that when you moved to Austin, what did that look like to shift licensing from state to state? That's the first part of it. And then how does that look now from your ability to see your own as a private practitioner?
Yeah. So when I was Austin, I was still in AMFT. So I was done with my hours. Yeah, their process is kind of weird over there because every state's different. And so I remember I was trying to get a license there, but they required for me to I have to go back to all my supervisors and get them to sign off on things. I already had that signed off already, but they needed me to do that. So like I said, I only lived there for a year, so I didn't have enough time to do that. So, but before I moved to Austin, I got licensed in California. And so when I was doing my private practice there in Austin, I was seeing clients in California. So because my license was only, I only could see clients in California.
So like Zoom calls and whatnot.
Yeah.
Okay.
So, and then, so once I moved back, when I opened my practice last year, June. So so that's when I kind of started doing my own private practice, my own thing. Cause I was working at I was still doing private practice, but it was through a different company. So it was what are those companies called? I forgot what they're called.
Some sort of license.
Yeah, there's some type of online therapy kind of
you. I always get podcast advertisements for it.
Like, I forgot what it was called.
Shit, Headspace. Headspace is one of them. And then there's another popular one too.
I can't even think of it right now. But yeah, so you know what I'm talking about. But yeah, so this one was specific. It was called Path. So I still work there because I want to keep that open because I think some patients, they have different insurances and stuff, and I've been working with some clients, so I'm not ready to transition out of there yet. So I kind of still work at this place called Path Mental Health. Well, they just changed their name to Rulo. It's a dumb name, but but it was before it was called Path. But I was working in Austin with that. And then, moved back here and started, opened so this is my own. So this is my own private practice. So it's called Abbott Psych. And, we've been open since June. And it takes time. It takes time to build it. You know what I mean? And so I got maybe about 4 clients right now in that. But it's cool because I get, it's hard to kind of building it from the ground up, you know what I mean? Because it's just, you have to market yourself. You have to put yourself out there. I have my own Instagram, therapy page. And so you have to do those. Now it's different, it's
the business side of things.
Yeah, it's the business side. Yeah. You have to do these marketing things. You have to do all these different little things to kind of put yourself out there and kind of market yourself. And then there's all these different types of websites out there too. There's one that's pretty popular one called Psychology Today. This is where a lot of therapists put out their kind of marketing, and a lot of people that want to seek therapy go through there. And so I have gotten some referrals from there. And then also, especially having that kind of emphasis with eating disorders, I know different nutritionists and different therapists that referred me clients and stuff. So it's kind of all that. It's the marketing and who and the different therapists, and also collaborating with the different therapists, and it can be transactional in a way. You're okay, if someone doesn't fit in my kind of practice, I'll send them over to you. And vice versa. So it's kind of all that mixed in.
Yeah, I mean, I would imagine, it's so. Correct me if I'm wrong. I don't want to put words in your mouth, but being in a place that allows you the flexibility of being your own boss in a lot of ways, but also having you can work for an organization as well.
Yeah,
that gives you the ability. I mean, technically, would you say you have 3 jobs right now? Is that?
Yeah, basically, 3 jobs. Yeah,
but I'm sure that the flexibility of having the entrepreneurial side of things gives you the ability to build your business and things like that too.
Oh
But
yeah, for sure.
is that kind of your end goal is to be like a full like self practitioner?
Oh yeah, most definitely. I think that's a lot of, well, I wouldn't say all therapists, because I feel like sometimes therapists, I don't know, like I've talked to a lot of therapists and they have this like concept of like, yeah, private practice, you're not going to make any money, and but you can make a lot of money doing private practice. And I think like when those therapists say that, I feel like you just don't know what you're doing. You know what I mean? And like it's about, and I think it's a lot of the older therapists that don't know much about social media and like all these things. So I think they're kind of just like trapped in that of like, well, we just only have one way of doing this. And
and then also with the modern like technology ways of doing stuff, like you can do that digitally as well too.
Oh,
you know? A lot of people maybe are even more comfortable with on a Zoom call or a phone call instead of in person.
Well, yeah, and I think the pandemic really fast tracked that for therapy. Because for me, I was kind of like skeptical about doing like online therapy. I just before the pandemic, I was like, I'm never going to do that. It was kind of like talks already about it, and it was kind of getting out there. But for me, I'm like, nah, you have to be in the room. Like you have to do like, that's where you like see all their nonverbal cues and kind of how they're reacting and all these things. And like being there, I think it's more comfortable for them being in person. But the pandemic like really fast tracked that a lot.
Forced us into it.
Yeah, forced us into that. So like for myself, even going into online therapy, it was so awkward for me because I'm like, I'm just used to doing therapy in person and seeing a person in front of me. But I got comfortable with it. And I think a lot of therapists are still stuck, kind of not stuck, but kind of sticking with the online kind of therapy, because I think, again, like with every type of like, institution and work, like people like, man, I have a life now, like I can have more flexibility. Like I can be more with my family and at home and do things for myself. So I think a lot of therapists are sticking to that. So if a person's looking to do therapy, you're going to see a lot of people are like, oh, I'm only doing online right now.
Yeah, I mean, there's also from a business standpoint too, like the overhead of having to rent a space and things like that too, or having your own space to do it out of your home or whatever too. We were talking about this offline too, but like me shifting from so as of December, I'm working for a new company now where I'm going into the office every day, whereas before. And a lot of people have kind of like questioned that about me, like why are you giving up your cushy at home job to go Monday through Friday back to a company where you're commuting and things like that too. For me, there's a lot of upside to it, especially having worked. So I was working remotely even before the pandemic. So the shift for that didn't really do much for me. But I just found that there was a lot of that was missing in the social interactions, and also like I think productivity wise, there's some benefit to meeting in person and stuff too as well. So I see a lot of really like great benefits to being in person. Like again, coming here in person is like I think it's tremendous for us to connect. It's been years since you and I have chopped it up. Yeah, literally, like,
literally a decade.
Maybe 11 years. I don't know when the specific was, but. Yeah, I mean it's an interesting dynamic in the way people are focused today, with that. Speaking along the lines, I want to I alluded to it a little bit earlier, but I want to dig into a little bit more of. So I'll start with a little bit of transparency and vulnerability within myself. It's an interesting take, and I want to ask your opinion on this because. I'm a huge advocate for therapy. Yeah. But the irony in that is that I've only been to a therapist once in my life. And it was a digital like experience. I was just mainly just doing it to see how like get the experience and like figure out what it was and stuff. And I opened up and like I think it was really helpful, but I didn't pursue it more than that. So the irony in me being an advocate for it is really it's interesting because in my mind, there's a lot of things that I do consistently that are therapeutic, but I see such a tremendous value in speaking to a professional about that.
Most definitely.
What's your opinion on someone that I'll caveat that with saying with there's two surface level things that are I guess skewing that decision for me. I'm Mexican. That's number one. Mexican people don't like
Most definitely. Yeah.
Okay, I'll one that the second layer is that I'm a male, and so traditionally I think that's kind of a machismo kind of move. And then the third thing is the Christian aspect of things. I'm not, like you said it, like maybe the historical advice is you're not praying enough, and all these things. So those added layers maybe have a stigmatized outlook that I'm looking at. Yeah. That. So what's your take on someone like me potentially that's I'm an advocate for therapy. But how would you advise someone that's kind of like in that space? What would you say? Like,
yeah. And I think it's, especially you talk about the culture wise, I've heard a lot of that. It's not just with like, Latinos, Hispanics, but it's all Asians, Indians, like a lot of that, so I think a lot of culture, especially like, I think you think about collectivistic cultures. It's like you rely on your family, you rely on that, or you don't speak about your family. You don't speak about things. You got to keep it between us and that's it. And so it's like this culture of kind of silence of that. And so, but I think that's a great thing about therapy is there's all these different, it's very diverse, you know what I mean? I think before therapy was very white oriented, and so I think that's why people didn't go to therapy, especially different cultures and different ethnicities, because it was very white centered. And and I think a lot of that, especially in therapy, in your, when you're doing your grad work and also, you're doing kind of like extra trainings too, because you have to do your extra trainings for your license and stuff. So I think a lot of that is about cultural competency and all that, and you're learning a lot about that, and which is great. They didn't have that back in the day. They didn't have any cultural competency type of trainings and all that stuff. But that's the great thing about therapy now is like you see a lot of different therapists that look like you. Yeah. And so they understand where you come from. They understand your family dynamic. They understand your culture. And I think like, and this is like, when I was talking about the psychology today, which is awesome that there's like a kind of filter kind of list or tab on there where you can say, if you feel comfortable, like I want a Hispanic therapist, or I want a Black therapist, I want an Indian therapist. So I think that kind of avenue allows people to feel like comfortable now because you're like, oh, I can talk to someone that understands me and gets me. So if that's your thing, you want to feel more comfortable or feel like someone gets you, then you can look for someone like that, But I think also the fact of, therapy, and I feel like sometimes people have this kind of black or white thinking around therapy where it's like, I have to be in this like deep thing or suffering and pain and trauma in order for me to go to therapy. But a lot of our behaviors and a lot of how we relate and act in the world is very unconscious. You know what I mean? And so when you think about like we were talking about earlier about like how we're shaped and formed by our own family dynamic, these are the first models of us of how do we relate with people, how do we love, how do we communicate, how do we talk, how do we treat each other. And so, even too, like, you may not have grown up in a very traumatic like family dynamic or family system, but there's things within your family that could be dysfunctional. And so, as kids and we're growing up, our brains are rapidly growing around that time. Like I was reading something where like our brains are like 90% adults when we're 6 years old. And so think about like everything you're taking in those first like 5-6 years of your life. You're seeing how your father treats you, how your father is like treating your mom, the conflict, the communication, those kind of nonverbal cues, all those things that are happening in those first 5-6 years are getting wired into your brain. And there's also this thing about like attachment, like there's a thing called attachment theory. And like, there's all these different attachment styles. Like there's like the secure attachment, the insecure attachment, the insecure anxiety attachment, insecure avoidant attachment, all these different types of things. And basically those things, your attachment style is created by how your parents relate with you. And so if you have a very chaotic kind of upbringing or like, or if your parents are just like aggressive and all these things like that, your brain is wired for that. Your brain is wired to see this is how we communicate. This is how we love. This is how we talk to each other. This is how you have relationships. And so that carries on until you're an adult. And so your attachment style or the way you're growing up will reenact in adulthood. And so a lot of our behaviors and how we act and how we're thinking and how we're relating is very unconscious. And so that's why, you know, someone can you get married, and then like all of a sudden, like you're just having all these problems and issues. You're like, what the hell's going on? You know, and then once you go to therapy, you start unpacking, like, yo, this is how my dad used to talk to my mom. And like, this is like what I saw in my family. I saw my dad not really, you know, he wasn't emotionally available. My mom was a reactive person. You know, I didn't have really a stable, safe environment. And then you start connecting the dots. You're like, man, this is why I'm like reacting and talking this way. This is why I'm behaving this way. This is why I can't have like a stable relationship with my wife or my kids. And so like, it's only until you make the conscious unconscious, then that's when you can make the change. But a lot of us are just kind of living through life very unconsciously, and we're just reacting, projecting, and we're not having good relationships. We're not doing great in our job. And like, why am I failing? Why am all these things? So it's like, that's why it's so important to like, you know, it doesn't even have, like I said, you don't have to be growing up in a traumatic event. Like we go to the doctors every year to get an annual checkup. Why not do that for your own mental health and head?
Yeah.
Go just get a checkup. Why not? Like, okay, everything's good. Okay. Not everything's bad, but like you may find out something about yourself that you can start kind of be more a self-actualized human being and be a better like kind of person in the world, a better dad, a better, you know, brother, a better like coworker, all those things, you know? So
yeah. And I think that's honestly, the sad reality is that sometimes people, they don't want to see that side of them, or they're repressing it in such a way that they know there's something there that they need to address. But it's, you know, it's like the same thing, like avoiding the gym, you know, because of whatever the difficulties of having to go through it, you know.
Yeah.
But the tremendous like effects that you see as a result, you know. I last year, I'm sure you probably have kind of gathered, I blasted it on social media, is I had a heart attack.
Yeah.
And so as a result, I you know, there's a lot of like, you know, changes and things that I've made to just my personal lifestyle that's been there. But what that came of that was the difficulties of like identifying those kind of things, because here's the reality, like the reality of that was, you know, the doctors didn't point it to any sort of addiction or any sort of like habits that I was doing particularly. I wasn't morbidly obese. I didn't have any comorbidities that were there. I know I was overweight and things like that.
Yeah.
It boiled down to genetics. But that could have easily been an excuse for me, like, well, you know, I got the shitty end of the deal, you know. But the reality is that I took some time to self-reflect and see the things that I was actually doing and making some poor choices about, like, you know, like just daily things, you know, why I was going for a hamburger instead of going for a salad when it was, you know, both were within, you know, reach and things like that.
Yeah.
So that was something that I think was tremendously valuable to see from the lens of like having gone through a near-death experience, really, you know?
Yeah.
And so, yeah, I see that there's a tremendous need for, so I'm basically, what I'm saying is that like, there's a lot of times where we as humans have to hit rock bottom in order for us to like make some sort of like conscious effort to want to better ourselves in such a way.
Yeah.
Is that something you see a lot of times more often than not, or is it the former where people are wanting to get ahead of like something that they see?
Yeah, it's a mixture of both. You know, I think some people come to therapy when they're just in huge crisis. You know what I mean? I think a lot of the times, I think it's an aspect of like just avoiding. You know what I mean? And don't want to deal with your shit. You know what I mean?
Yeah.
And like, and it just continues to compound, and then eventually a crisis happens. Whether it be a divorce or infidelity or, you know, all your relationships are shot, you know, and so it's like you're left alone. You're left like feeling depressed and sad and like, why is this happening to me? And so that's when sometimes people just come to therapy because of that, because everything's in shambles, you know. But I think some people start seeing the signs, or they start seeing like these kind of like patterns of behavior, patterns of like how they're dealing with in their relationships or in their own life or with their own self. And then they just start seeing it like, man, I need to take care of this. You know what I mean? Like, this is an issue and a pattern that keeps coming up in my life, and I want to deal with this.
Yeah. That's tremendously insightful. I think that I needed to hear that. Not necessarily. I'm not speaking to the audience here. I'm speaking to, you know, within myself. So there's something also that, so the hot button topic that I really want to dig into, because
Mhm.
I know that you, I don't know if this is a specialty of yours, but it's something that you, I think you have some insight on that would
Mhm.
be tremendously valuable for me to ask about that too.
Yeah.
I'm curious about your so the stigma. So I'm going to back up and say that because of the apostolic Christian upbringing, and the
Mhm.
stigma of like substances in general, there's a I've dabbled in weed and
Mhm.
in drinking and things like that too, but the 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 psychedelic movement, that's kind of evident now.
Yeah.
I think I'm hearing more. I base it mainly on my consumption of podcasts that I listen
Mhm.
to. Theo Vaughn
Yeah. Theo
is
Vaughn's my favorite. I love that
yeah.
guy.
So he's had a lot of people on recently that even I just heard the latest interview where a guy named Billy Strings, who's a musician, he had his really insightful like experience with some hard drugs and also psychedelics. But I'm curious about how that has been a tool for therapy and
Mhm.
or a help for others, and what that's kind of been
Yeah.
for like.
Yeah. Psychedelic therapy, it's interesting because psychedelic therapy was coming onto the scenes around like, let's say the 50s and 60s. That's when it started like wanted to do research and people were using psychedelics in therapy. Like there's these guys are called, his name is Timothy Leary, Richard Alpert. These were kind of like the pioneers of like bringing psychedelics into society. And they were Harvard professors, and they wanted to do some studies, and they were doing some studies and stuff. And like the college or Harvard University wasn't like really into it because it kind of got out of hand a little bit too. So I think like you look back in history, um, other people were doing research around like psychedelics before, and they were doing it more in a conservative way. They were kind of got a little out of hand.
They were doing
Yeah,
research,
they were
huh?
doing research, and like there's a study out there called the Sunday Experiment or the Good Friday. That was a Good Friday experiment. You can look it up, but they were doing actually it was on Easter, and so what they were doing, there was like a church on the Harvard campus, and they were doing like their Easter service on top, and then in the bottom basement they were doing mushrooms.
Mm.
And so they wanted to do this experience simultaneously with Easter to kind of see if like you can have a mystical experience on mushrooms. And so they kind of did that study. And I think after it kind of got out of hand because people like they started giving mushrooms to other like people, and then like kind of got at people, some people are. That's why I say with psychedelics, not everyone should be doing that. I think you have to look at like your family history. If there's any history of psychosis and things like that, bipolar disorder, or schizophrenia, you may want to refrain from that because like if that's in your family history and that's in your genes, that could get turned on by doing a psychedelic.
Interesting.
So that's kind of where people need to watch out for that. So during that time, I think people were like kind of losing their mind a little bit, and then Harvard, it's kind of just cut it off and then fired them, and they kind of started doing their own thing. But before that, even too, during that time, they were using LSD also for substance abuse. And if you know the founder of AA, well, I forgot his name, but he got cured of his alcoholism through LSD therapy.
Interesting. I
And
didn't know that.
he wanted to bring that into the AA, but because with AA, like you're abstinent from all drugs, that wasn't anything that like you couldn't bring into that program. So he wanted to do that and bring LSD and start curing people of their alcoholism, but he didn't put that in there. But they were doing a lot of that back in the day. So like in the 50s and 60s, there was a lot of like research was going on. It was like kind of, coming along. And then that's when during like the hippie era and then, the 60s and the summer of love and all those things, and like a lot of people were just doing acid and doing all these psychedelics. And that was during the time of the civil rights and Vietnam War and all these things. And I think a lot of people were waking up to society and waking up to like just the corruption that was going on in our government, because it was almost like a period of time during like the 50s. It was kind of like this like traditional type of like family, a lot of these like women didn't have a lot of rights, men were controlling, and there was a lot of abuse and physical abuse going on in homes. And so like these kids that were growing up in that, they were just so disillusioned about life and disillusioned about society, their family life. And I think that's when like really, they got into psychedelics, and then that turned them on and woke them up, and they're just like, man, this fucks society. We don't want to deal with this. We don't want to be in it. Like, this is so corrupt. And so like everything's a lie. Mm-hmm. And that's why people were waking up during that time and during the Vietnam War, civil rights. And that's where like, there were, a lot of people were protesting against Vietnam War. And so I think that was a threat to our government. It was a threat to our government. It was a threat to the progress of this kind of military industrial complex and all these things. So I think there was an avenue of like, if we can squash this, we'll just kind of like, let's make it illegal. We're going to put laws against it. And that's when, they put all these laws and these schedulings of drugs. So like, that's why most psychedelics, you'll see they're Schedule 1 drugs, meaning they have no medical purpose, or they can cause addiction, which is false. Like, it doesn't cause any addiction. There's no properties of addiction or withdrawal or any of these things. But fentanyl and all these type of like, oxycodone and all these things, those are Schedule 2, and that's okay to do. And now in our society, everyone's dying off of fentanyl.
Yeah.
But oh my God, psychedelics, mushrooms, no, we're going to keep it Schedule 1.
Yeah.
And so there's all these lies. So like, that's when it started happening in the 60s. They started kind of making illegal like psychedelics, and then they kind of squashed the whole hippie movement. And then this whole era transitioned in like the 70s, 80s. And then the 80s, there was a lot of that with ecstasy. So the 80s that's when it started becoming big, and in the raves and all these things like that, partying and all that. Then they made that illegal. And so, so a lot of these psychedelics that are now, a lot of people now, it's kind of in our society now. A lot of people are open to it.
It lost the stigma a little bit.
Yeah. And, there's an organization called MAPS. It's called the Multidisciplinary Association of Psychedelic Studies. They kind of started their nonprofit in the 90s. And this kind of organization has been, funding and pushing psychedelic research. And they're the ones that started funding the research around MDMA and PTSD. So that's kind of like the really first studies like in our kind of common era now, where they're using MDMA to treat PTSD. And so their studies that were using MDMA to treat veterans of war. That was their focus. And so they've been through all the clinical trials now. So they're done with all the phases, because there's like 3 phases of clinical trials. And so this last one they did, the phase 3 of the clinical trials, it showed the participants that were in that group, they showed like 72% of individuals that had PTSD no longer meet PTSD anymore by using the MDMA therapy. And there's no other therapy, especially trauma therapy, that shows that type of results.
Wow. Well, I mean, and it's to that point. I wonder like why there's such a stigma on that, and I know that my own personal like influences have my own, the reason why, and it's probably largely due to a lot of similarities for other individuals as well, that have like a background of, whatever influences that kind of stigmatize that as well. So you talked a little bit about like some sort of like genetic dispositions that one has that could potentially be harmful in sort of experience. Who would you say are the prime candidates for psychotherapy or psychedelics that are as a means to as a tool?
Yeah, I just think, in a therapy sense or a therapeutic sense, I think people that do have PTSD for sure. I think like people that have really severe trauma and that actually tried therapy, they've tried all the medications, they've tried all these different types of therapies to help cure them of their PTSD, and it's not working. I think that they could be a prime candidate for it. I think also, especially with like psilocybin mushrooms, they did some studies at Johns Hopkins University where a specific population of people that had end of life cancer or end of life terminal illness. And a lot of them were fearing their death or fearing their demise and had a lot of anxiety and depression over it. And they just wanted to help them kind of, allow them to have like at least some kind of dignity and some kind of peace over their death. And so they did some studies over there. And they gave them, actually it was pretty impressive of like how they were cured of their anxiety and depression, and kind of what they also saw was they brought meaning to their death also. And so before I get into that, so with like MDMA therapy, what helps allow people to heal from their trauma using MDMA is there's a part of the brain called the amygdala. And so the amygdala is our fear center of the brain. And so whenever someone does talk about their trauma or like get into it and start verbally talking about it, that part of the brain becomes so active. That's why it doesn't allow people to really talk about it, or they have like these flashbacks, or they have, you know, these type of PTSD symptoms that come that doesn't allow them to be able to process their trauma. And so what MDMA does is shut that part of the brain down, and which gives them a sense of safety internally and be able to like start talking about it, processing it, and kind of creating a new story, a new narrative around their trauma, and like just being able to get over it. So that's the kind of mechanism or the catalyst of change, is that part. The MDMA shuts that part of the brain down. But with psilocybin, which is interesting because it's the more of the mystical spiritual experience that people have, what creates that change for them. Because MDMA it's called an empathogen. Basically, an empathogen is just more of like you get more into your feelings and have more compassion and love. It's not really a thing where like, yeah, at raves, if you know, you're seeing all the lights and, you know, you're partying and stuff, the music is great. Like you have those type of experiences of visuals. But psilocybin, there's something really spiritual about it, because when you take a good dose of it, you can really go deep and have really spiritual experiences, or just really like these crazy visuals, or like just really deep meaning. Because I feel like, you know, for me, psilocybin is more of like a really reflective and contemplative thing for me, where it opens my mind to be able to like really just like look at myself, look at my life, look at myself, look at the world, and you feel more connected with yourself. You feel more connected with the world. There's this part of like, you know, a lot of life where we see now, it's everything's divided. Everyone is like just like hating each other. You're looking at the enemy, but like psilocybin kind of gives you this kind of perspective that like, man, like we're all the same. We're all one. We're all unity, you know, and like I don't look at you as the enemy. Like you are me, and you are me. And so it's like these perspectives help to like change like just how you look at the world, look at yourself. And so with this study, they just gave them one dose, and I think it was like over 70% of people that had really severe anxiety and depression got over it. And they were able to like kind of find acceptance through their death and their demise, and also have meaning like, yeah, this is not the end. Like, I think a lot of people with death, is what scares them is it's like, oh, I don't exist anymore, you know? And psilocybin kind of gives you that kind of experience of like, yeah, I think there is an afterlife. I feel like this doesn't end. Like, this is just a part of this kind of journey of our existence, and it just doesn't end right here on earth. I think something goes on after, and it gives them that kind of perspective and gives them that peace to like, okay, like I don't die.
Yeah.
Nothing ever really dies, nerd.
Yeah, there you go. Do the
Yeah.
Pharrell symbol. It's interesting because like it kind of full circle comes back to the conversation about like us being parents and the legacy in which that we try to continue beyond our own lives, you know, because mortality it's inevitable.
Yeah.
And to think about these kind of things, you know, when you're in a state. So for me, I remember being on the procedure table when I was having my heart attack, and I had this eerie sense of kind of peace at a point where I was fearing for my life and fearing for death, and you know, fearing that the last time that I was ever going to see my family was going to be the moments that I shared, you know, and in my mind, like the thing that stood out to me is like it was just such a casual goodbye. And
Yeah, that's scary. Yeah.
and so, you know, everybody, like, you never expect to have this profound, you know, like I didn't, you know, kiss my wife with passion, and you know, I didn't hug my boys tight, and I didn't do all these things that I had hoped for at a certain point. But when there was a sense of almost like an eerie sense of peace that came upon me, of just kind of like, you know, and it was just like, you know, well, if this is it, you know, in my mind, I was like, you know, I hope that God takes care of my family. And it was just like a moment of like acceptance of my fate, you know, no matter what was happening. And now in retrospect, looking back at that, it's kind of it's a unique way, because I'm like, why the hell was I thinking that at the time? Like, but I've got, I'm too young. There's so much more to live for. But it's just when you're in that place, it's it's just it comes upon you, and it's hard to control at that point. I'm really glad that I'm here right now. I'm really glad that I'm continuing this life. But yeah, I totally get that. I think that there's such value into seeing something outside of yourself. That's and in a lot of ways, I think it's we're just naturally selfish people, and it's hard to do that on a regular basis, to think that like you're not the main character in the story of your own life. I do want to shift gears though a little bit and talk about like the Therapy House podcast a little bit. And kind of where that idea stemmed from, and how it's been, how you have collectively been able to kind of talk about. It's more so like I found that the camaraderie that you have with other therapy and mental health professionals, that in itself is pretty interesting, because you're like, you guys are shooting the shit as therapists, and there's a lot of like the stigma of like, well, this therapist is the robot that I spew my word vomit at,
If our clients heard that.
But you're like, hey, he's a human too,
we're all humans. We're all, dude.
But yeah, how's that been, the podcast?
Yeah, it's been cool. I think the concept came about like, so I lived actually with two of those guys that are on there. We were roommates, and we always used to call it Chill House, so like we were just, everyone would come over and we'd just chill and hang out and stuff like that. And so the guy, John and Jeremy, I lived with them both. And so we were roommates for a bit. And then the other guy, Jeremiah, I met him when I worked at Starlight Community Service. So how I met John and Jeremiah and Jeremy and Jorge. So John and Jeremiah, I met them both where I worked at Starlight Community Services. So I met them there, and then the other guy, Jorge, is like best friends with John. So I met him through John, and then Jeremy came along maybe a couple of years later and lived with us. And he's he's not really a therapist, but he has a doctorate in education, and so I don't know if he still works there, but he was working with refugees and doing like case like social work and stuff like that with them. So it was Jeremiah that actually was the one that like came up with this concept of like, yo, we should do a podcast. Like all of us should do this. And we're kind of like, yeah, let's do it. But like none of us were kind of like pushing it, but he would always come back. He's like, bro, we got to do this. Like, we got to do this, man. This would be super cool. And so like, finally, like maybe, what was it? I think we did it before I moved to Austin. Because we kind of go through seasons. And so we did season 1 before I moved to Austin. It was like 2021. That's when we started. And so, so we came up with the concept because it was like Chill House. We'll just do like Therapy House. So it's like, that's how we came about with the name. And, so we kind of just wanted to come from the perspective of like, like therapists, and like, we do want to talk about and kind of give like education around therapy, but also kind of like who we are as therapists, kind of like show who we are individually, like outside of the therapy room, and like kind of give insight into like what therapists think and how they act, and kind of like their insight as therapists, and kind of just show ourselves in a way, because I think sometimes like we come in with a role of being a therapist, and so everyone has their kind of different like styles of how they show up in the therapy room and all that. But like, so we kind of just wanted to let loose and be like, yeah, we're therapists, we're human beings too. We have issues too. We have things, we've been through our own traumas. We all been through our own like kind of heartaches and suffering, and our own growth and everything like that. So we kind of want to share that aspect. I think season 1 is a lot more about that, of like kind of more of like who we are as people, like our struggles, our challenges, like how we got through it. And season 2 is more like, now we're inviting guests and stuff like that, and like kind of more going deep into like different therapy topics and all that. So that's how it all came about.
Yeah, it's highly entertaining, and I like, you think you guys, I mean, it's probably because you guys are friends, but having the banter, I think is super cool too. I was thinking about something actually earlier on, and it just reminded me right now. I was getting, so there's 2 things that I was thinking about. Number one, there's almost the trope that people that pursue psychology are trying to find an answer within themselves, and so
that's
maybe
true, bro.
I was gonna ask you, is that more often than not the case, is that they're looking for answers within themselves?
Yeah, I think a lot of therapists get into that. I think they're trying to figure out their own shit. But also they have this feeling I want to help people. But that could be dangerous in itself too. Like if it's unfettered and not really managed, like you can hurt a lot of people, and that happens a lot too in therapy. Like in therapy, like there's actually I think it's like you have to be a part of this organization called the California Marriage Family Therapist. They always come, I think it's like every other month, or I don't know, I forgot the frequency of it. They send like this, like kind of like magazine, and all of it's like different therapy topics and everything like that. But the interesting thing in the back, they used to call it something different, but it's like the disciplinary, page of different therapists. And so you can look at that, and there's all these different types of disciplinary actions that have taken place with like therapists, where
like to be reprimanded, and
you can read like what they did or why they got their license revoked and shit. And it's funny, a lot of them is like DUIs, like driving under the influence of drugs or alcohol, or like having sex with their their clients.
I was gonna ask, that's probably because it's a very vulnerable, intimate setting, and if like the lines get blurred and you're like, man, there's a hottie on my
yeah, dude, if you don't got your shit straight, bro, you'll mess up. So like yeah, and I think there's also a power dynamic involved too. As a therapist, you're in a power position, and some therapists like take advantage of that. Yeah.
Wow, interesting. And then the other side of things is like, so maybe this is actually the positive spin on that thing is that it's kind of a meta thought, but like, do you find that giving therapy advice is therapeutic in itself? Like, because I think about it, like, anybody that has a profession in which they are doing it. So like, for example, a musician will find probably some value in teaching music, or like giving musical advice to others. So is that kind of similar? Like, do you find value in that?
Yeah, I think so. I think you gain some you gain some insight for yourself. I think sometimes there's this thing called counter transference, and so that's kind of like a typical phenomenon that happens with like therapists and their clients. And what that is that a patient can be, or a client can be like talking to you, and then it triggers something in you. Like, so if they're talking about a certain trauma or certain dysfunctional pattern or behavior, or just even something that like bothers you, that like maybe it like kind of like goes against your values. And then it triggers like some emotional reaction in you, and you can get really triggered and really distressed about it. That tends to happen too at times with therapists. And so like, where it started activating your own bullshit or your own like dysfunction or things you need to work on. And then like that signals to you, you're like, man, I need to go see my own therapist, because like this is triggering me, or this client is triggering me, or it's associated with my father, or associated with my mother, or associated with like an ex-partner. And so that's triggering me. And so like that tends to happen a lot in therapists too. And so, so that's kind of like maybe, I don't want to say the negative side, but I think it can be enlightening for you as a therapist to like, I still need to do some work on my own self. But also then in fact, I think also like giving, like helping people, and like, I think there's a benefit to it too, of like kind of looking at yourself, or also reminding like, I need to do this stuff too for myself. Yeah. Like, I think sometimes therapists, we can be hypocrites too at times, where like we can just be giving the knowledge, but then we're not applying that to our own life, right? Or we're not doing the work. I find myself doing that at times too, where like I'm just saying things, but then like when it comes to other things in my life, I'm not implementing those things. I'm not being a model for my own clients. And so like, I have to look at myself and say, well, I need to follow through. Like even my wife will say that at times. She's like, when I'm like getting heated, she's like, just do some breathing, do some box breathing. You tell your clients that. I'm like, shut up, dude. Don't tell me that. But like, but it's those things like that. You just have to like, you just have to remind yourself and like kind of bring you back and sit back and reflect and be like, I got to do these things for myself too.
Yeah. Dumb question. Do therapists have therapists?
Oh, most definitely. Most definitely. Yeah, most definitely. Yeah, I'm going to be getting back into therapy actually this weekend. But yeah, I think it's super important for a therapist to see their own therapist, because, I think just the amount of traumatic stories you're hearing, the amount of, pain and suffering. And that's why there's a term called vicarious traumatization. And so like you as a therapist can be traumatized by just the amount of stuff you're hearing and the amount of the stuff that you're seeing. It's like even with like police, police see so much like shit out in society, and they're seeing death and just like the despair of like humans. and they get traumatized over that. So it's the same thing with therapists too, as we're just continuing to talk to people and hearing suffering and pain all day, that can affect us too.
Yeah, I mean, nothing short of having a disorder, I think, as a result of just being numbed by it, because in that in itself can be like, yeah, you're just because anybody that's effective in what they want to do, especially police officers, therapists, people that are like working with people in these traumatic, first responders in a lot of ways. If you are an empathetic person at any level and you are genuine about like wanting to help and save lives, then it's got to screw you up. It's got to really, really like get your shit all out of whack, because that is that in itself can be, I think, something that I can't even begin to understand, because you're a shock absorber. You're taking a lot of the things and trying to be a strong person for someone else in a dire situation.
Most definitely. And I think that's a skill for all therapists, is to learn how to detach, after a therapy session or when you're done with the day. Because I think sometimes if we hold on to things and we're really taking it outside of the therapy room, bringing it to our own home lives and our family, you can get burnt out pretty quick, and you just start losing that kind of passion and that kind of zeal, want to help people, and so it's the skill of learning how to detach. And I think some therapists feel bad about that, because they're they care about their patients, they care about their clients, and they feel for them, but also there's a negative side of that too, of it bleeds into your own life. And so you have to learn to detach. You have to learn to just let go and just be okay with what you did in the therapy room. And if it's not all resolved, or they're not at a place of being okay, you just have to say, okay, I did my part, and I gave, we'll do it next week and we'll come back to that.
Yeah. I was thinking, I remember the online platform that I was trying to think of. It's called Talkspace.
There you go. Yeah.
I said Headspace or something.
Yeah, that's the meditation app. Yeah.
I had these random thoughts that just pop in my head at a certain time too, but I could hear the podcast advertisements running through my brain at the time. I want to talk about some of the on the lighter side of things a little bit too. What are you? Is there any self-help, or not even maybe necessarily self-help, but just something that has been a good anchor for some people that you would recommend from a practice standpoint or a educational standpoint? Is there a book that you've found very, very insightful, or a daily practice or anything like that somebody can participate in that you found particularly helpful?
Yeah, I think when it comes to books, I think good one, especially you want to learn about trauma, or what has happened to you, or what's going on in a physiological sense, or how does trauma work within your own brain and all that. There's a book called The Body That Keeps the Score, and it's called, I think the author's name is Bessel van der Kolk. I think it's something like that. But he talks about the aspect of, I think trauma is not just a psychological or cognitive thing, but I think trauma gets stuck in your body. And so this is why when you think about people getting triggered, or people getting flashbacks, hypervigilance, those things, you can just be, let's say you're standing in the grocery line, and then you're kind of just waiting to buy your groceries, and then all of a sudden you get a whiff of a smell. And then all of a sudden your body just starts getting activated, where you start feeling fear, you start getting hypervigilant and aware, and you're not even thinking about anything. But because of that smell, it starts activating all those trauma symptoms, because it's associated with the trauma. And so, I think a lot of, especially with research and science and evidence that we have found now, I think trauma is such, not just this psychological cognitive thing, but actually it's in your body. It gets stored into your body. And so things will just trigger it all the time, and you'll start feeling the physical sensations of fear, or put you right back to where you're at. And so that book kind of explains a lot about that, and helps people, because it's I think people really feel either shame or guilt, especially when they're trauma, and they start getting triggered and activated by something. It could have been something that someone said, or this person is associated with someone, and they just start getting triggered, and they just don't understand, why am I reacting this way? And so I think that kind of destigmatizes a lot of what's happening in trauma and what's happening in your own body, and just gives you some education on that. So I think that's a really good book to read. And there's a book I'm just reading recently. It's called How to Be the Love You Seek, and it's by this psychologist named Nicole LaPera. She's pretty popular on Instagram, the holistic psychologist, and she's wrote a couple of books, and her kind of social media handle or profile is pretty popular, and she has a lot of good content about like all these different topics of like psychology and trauma and things like that. And so it kind of teaches, like, it's kind of like talking about how like I was explaining before, of how like we're a lot of our how we see the world and how we relate with people all starts at our home and in our family. And a lot of the times, like we, at times we can choose partners that feel familiar, like our, what I call emotional home. So emotional home sometimes is not good. And so our emotional home can be very chaotic and very dysfunctional, and like seeing a lot of unhealthy relationships. And so, because it feels so familiar to us, we'll choose partners that feel that familiarity. And so this is why people continue to get in toxic and unhealthy relationships, because they're just reenacting their family home and family system of what they saw in their father, what they saw in their mother, their relationship and all that, and how their parents related with them. And so that's what I'm saying. It's very unconscious, and we will choose people over and over again. If we don't get that managed or healed, we will just continue to choose partners that are like our mothers and fathers in our home. And so that book kind of talks a lot about that, of like healing that part and kind of being more aware of these kind of unconscious like ways of how we pick partners, how we choose our, husbands and wives, and our friendships and all these things like that, because, we can just continue to get in these toxic cycles with people, and it just continues to just causes more detriment. And so that kind of teaches us how to heal that, and how to just, choose more healthier relationships and kind of heal that parts of ourselves.
Interesting. Yeah. I think that's it, both negatively, positively. I think even hearing you say the words, I haven't, read either of those books, but like, I'm reminded of times that like smells it can be a positive experience as well, like,
most
like,
definitely,
like grandma's pozole or something like that, something that triggers a warm feeling or sensation that can be positive in that same way too. So yeah, I'm definitely, I'm prone to, I feel like my own personality is very like, there's half analytical, half like creative. And I kind of need that for my work every day. There's a lot of problem solving and big picture stuff that I'm, leading a team. I'm kind of immersed in, but there's also like the creative part of my brain that is like, very whimsical and like prone to like, imagine and, so I'm kind of pulled into these like thoughts sometimes that will sometimes it's irrelevant to the situation that I'm in, but I'm like, it also can be a good way to like critically think in a way that's going to solve a problem at the time too. But I said all that to say that I think there's tremendous value in us continually like seeking out the ways in which we can better ourselves, and then be a catalyst for others as well. Too,
for sure.
Okay, so I want to. We've dove into some super heavy topics now, but I want to get on like a little bit more of the fun side of things. When you, I remember, historically, like we talked about like the cultural proclivities for one like maybe cultural group that seeks out white people are typically known to be the seekers of therapy. And more specifically, like back in the day, and every trope was always like a German-based like therapist, like maybe it's like Freudian or something.
Sigmund Freud, Carl Jung, all those guys.
Yeah, something with like, what is your problem? Like they dig into that or whatever too. How has it been like? So when you go to a cocktail party or whatever, and you meet somebody for the first time and you tell them you're a therapist, what's like the kind of the negative like, or do people like try to like probe you for some free therapy or something?
Yeah, that's why I don't say much. I'm a therapist. I was like, I'm a sanitation worker. No, but like
I clean up shit for a living.
Yeah, I just clean up. Yeah, I just clean up festival fucking porta potties. But no, No, but at times yeah, like I'm always kind of careful about that because it just depends if I know this person or I kind of at least I know them a little bit, like then I'll like say I'm a therapist. But like sometimes I'm careful about saying that because I've been at bars, bro, and like and there's this random guy and I'm talking to, he's like, what do you do for a living? I'm like, and that was my mistake. I was like, I'm a therapist. He's like, oh, really? Like, let's talk about my childhood trauma right now.
A couple more rounds.
Yeah, I'm like, fuck, dude. I'm like, yeah, because I think a lot of therapists, I think they don't give a fuck, dude. And when they're off the clock, they're just like, I don't give a fuck about your problems, dude. Don't tell me about anything about your problems. I don't care. But
I mean, it's hard. Like you've been dealing with that all day, you know. Like it's I'm the same thing. Like if you know if you're a computer programmer, or somebody's gonna ask you about a software development technique or whatever like that. You're like, I don't give a fuck.
Like don't ask. Yeah, so it's interesting. There's been times where that's happened to me where I'm just like, God damn it, dude. But like But yeah, I think a lot of the time, like, are you asking like about if people have any like biases or any type of like ways of looking?
Yeah, or the opposite side of that is that when you tell them you're a therapist, they're like, whoa, I'm gonna watch what I say around you, kind of thing, or because I would say that I've seen people's reaction to that and be like, like, I know you're psychoanalyzing me right now, everything that I'm saying or whatever, like.
Yeah, I think people jokingly, they're like, are you trying to analyze me right now? I'm like, no, I don't care. I don't want to analyze you, dude.
I'm not trying to diagnose you.
Yeah, but sometimes it's very evident. You're just like, oh, this person's fucking crazy, dude. So you're just in your therapist's mind. You're just like, damn, dude, this guy has problems. But yeah, like people just jokingly around like that, they'll just be like, "Oh, you're trying to analyze me? What are you trying to read my mind?" You're like, "No, I can't read minds." I think what was it? What was it that movie? What was it with? What is it? Was it the Anchorman? I think
with Will Ferrell.
Yeah, I think they said something about like a therapist like reading their mind or something like that. I don't know. Yeah, but some like it's funny how some people are like,
are you in my brain right now?
Are you in my brain right now? I'm like, no, I can't read minds. But yeah, it's interesting. You get a mixed bag sometimes, But it's interesting. I've never ran across anyone that's like against therapy or like, oh, you're a fraud, or because some people think that like therapists are frauds, you know what I mean? They're just kind of like, why are you gonna go talk to someone and pay that much amount of money to talk about problems? Like, whatever, dude. Like, so never ran into that type of person, but mostly it's been kind of positive for sure, or jokingly, people joke around.
Yeah. I mean, that's a good, I guess, a good sign of the times. I think, people that are open to that, because I would say that maybe back in the day that would have been more of a, like, you quack or whatever, that they express that there's a, but I think that again, like the trend of like people like being open to it now is a good thing. But speaking of that, do you feel, I mean, is that, I keep on saying that and then I'm just alluding to that.
Yeah.
But do you feel like society's kind of more open to like seeking out answers for mental health now?
Well, it's definitely, I think it's the stigma of it has gone down a lot for sure. I think especially like our parents' generation, like that was not a thing that you do. You know what I mean? That's a thing that like it's a no, and that's for like people that are crazy and like have like schizophrenia or crazy mental health issues. You don't go there, because it's such a stigma. And I think this is why like this generation is so more open to like want to change and really delve deep into generational trauma and their own kind of like issues and problems, and more open to it. Cause I think like, it's such a more like, I think people are just more open to it now. And I think like learning from their own family trauma and understanding that, they're just like, I want to heal from this, cause like generational trauma just gets passed down from generation to generation. And it's only until someone like stands up and say, I'm going to feel all this and I'm going to like process all this. And that's when change can happen in a generation or in someone's lineage. Someone has to stand up and say, that's enough. We're not going to do that no more. Because, I'm sure in all our families, there's all these family secrets. There's always these things that happened and no one wants to talk about it. It's only until someone wants to talk about it, that's when things can happen and change. So I think, especially the advent of like internet, social media, like that's such a huge thing. People talk about mental health all the time. And I think a lot of now more like we see in like sports and like in music and all that. And a lot of these artists that people really look up to are like, they're talking about their mental health issues. They're talking about their struggles. And I think that opens the door for people to like start talking about their own and say, maybe I need help too. Like I see this, I see this artist or see this guy, NBA player going to therapy and talking about their issues. Man, I want to go talk about mine too. So I think all these different avenues that have opened up and allowed people to like really like see mental health as a positive thing and something that could be beneficial. So I think it's a really great time to be alive right now, especially for mental health, you know?
Yeah, I completely agreed. Especially like, us being in the, like if you have the stereotypical tough guy that's willing to talk about and being vulnerable enough to like talk about their struggles, maybe that's a recipe for someone, I think, to explore their own internal struggles.
Yeah, especially for men, men's really hard to like open up and be vulnerable. I think like this is why in a time now more than ever, men feel lonely and disconnected and have few friends, you know what I mean? And I think there's a lot of factors that are involved in that, but I think there's a vulnerability factor too that plays into a role. Like we've all been conditioned to only express like one emotion, and that's anger.
Yeah.
But because it's like anything else is like you're a wimp, or you're like, you're a pussy or something like that. You know what I mean? If you talk about your emotions, and especially if you live in a, inner city or kind of like a ghetto, like you don't talk about your emotions and feelings, or you grow up in a low income like area. You have to like fend for yourself. You have to fight. You have to struggle. And like part of that is just like you just express anger, and that's it. And I think, we all been conditioned as men to like really just shut down our emotions and feelings. And, and it's always like, oh, the women only express their emotions and feelings, but I think now more than ever, we're talking about that now. Men are opening up, men are talking about their emotions and feelings, and that's okay.
Yeah. No, absolutely. I think that's far often something that we don't do, and like, or we put up these walls that I've even personally said things like, I'm going to tell you something, but this stays between us, like, with such a shame of like the even the hint of vulnerability, and I mean, I think that's something that we need to break away from, and I know that personally, I'm preaching to the choir because I'm basically speaking on my own behalf,
Yeah.
Okay, so I want to and cap things off a little bit. We can land the plane a little bit here, but I want to do some rapid fire questions here. Then throw them your way. All right, you're at a karaoke bar. Someone signs you up for a next karaoke spot. What's the go-to song that you can think of on the spot that would be your karaoke song?
Yeah, I thought about this. I heard you other podcast talking about that. Now I've been to karaoke bars, and my always go-to is Sunday Morning by Maroon 5.
Okay, that's a good one.
I love that song, bro.
That's a good one.
I love that.
You reminded me earlier. My go-to song is it's a Pharrell track, but it's Justin Timberlake, Senorita.
Oh yeah,
that's my go-to
great song. Good song. That's a great album too.
Yeah. That was the one. Like I used to go. Actually, when I lived in San Jose, I used to go to Japantown.
There's
a little karaoke spot that I've sang that probably 3 or 4 times at the spot there. Okay, and if you're this is a 2-parter. I'm gonna use the one from I did from last podcast as well. But if you're trapped on an island, the assumption is that you're stuck there for 2 years before you get rescued.
Mm-hmm.
You can bring 3 books with you.
Mm-hmm.
I asked you about that. Maybe those are the books that you're currently reading, but it could be any 3 books that are going to entertain you for 2 years. And you also have a magic vending machine that will give you any meal that you want. But it can only be one meal consistently. Right. What are the 3 books, and then what's the meal?
Yeah, the 3 books. I think you mentioned in the last podcast. It was my favorite book. It's the Paulo Coelho, like The Alchemist. That's like one of my favorite all-time books. I love that book. I would bring this other book called Chaos. It's by this guy named Tom O'Neill, and it talks about like Charles Manson and the family, and how Charles Manson was part of this program called the MK Ultra, where they would dose people with psychedelics or LSD. There was a period of time actually where the government was actually, without any people's knowledge, were dosing people with acid because they were trying to use that as a way to mind control. And so Charles Manson was part of that kind of program, the MK Ultra, and also the Unabomber Timothy McVeigh was also part of that program too. And so it just went south with that guy, with Manson and Timothy McVeigh. And so it shows all this like research and evidence that show that he was part of this program, and how like the CIA would, like every time he would get arrested or like something happened criminally, they would always bail him out. And basically a lot of what was going on is they were just trying to put a damper on the hippie movement and try to make it look bad. And so they would use all these different people to mind control, and then also they would prime these people to go and control and manipulate other people too. So that book is all about that. It's a great book. You should read that.
What's the title again?
It's called Chaos.
Chaos. Yeah, that sounds super interesting.
Oh, actually. Super! It's a great book.
Third book. Cat in the Hat.
Cat in the Hat. Green eggs and ham.
Yeah.
No. I think I want to bring like a psychology book. There's a book called No Bad Parts, and it's this therapy model called Internal Family Systems, and it talks about like how we all have these different parts of ourselves that we create along the way due to pain and suffering, and actually like let's say for example, if you're like a 12-year-old 13-year-old that got hurt, like there's like this like 13-year-old hurt boy that's inside of you, and you can be 36 years old and that hurt boy can come out in different situations. And so it's a therapy I use that in my own therapy, like when I do therapy with people, is like getting to know these parts of ourselves and understand why they're there, what's their purpose, what's their function, and to be more like graceful and more compassionate to these parts, because these parts serve a purpose, and that's why it's called No Bad Parts, because they all serve a purpose and a function, whether they're there to protect us, whether to help us, support us, but they're also not serving us any longer. So finding ways to be able to relax these parts and be led by self, it's called self-led, like who you are as a person, to be led in most situations. So I would bring that book too.
Wow. That's a good one. It's almost like the Native Americans in the buffalo. They use every single part, you know?
Yeah.
How about the meal? What's the vending machine?
Yeah. I would, there's a great barbecue spot in Austin called Terry Black's, and they have the best fucking brisket ever, dude.
What's the popular one that everybody goes to?
There's Terry Black's, and then there's Franklin's.
Franklin's is the one that I've heard of.
Yeah, but Terry Black's is way better than Franklin's.
Really?
Oh, dude.
Okay.
So I would have a pound of brisket, and I would have some macaroni and cheese, some baked beans, and I think that's it. Oh God, I love that. I love barbecue. First of all, I can't. Yeah, that's like my favorite food. So
yeah, Tammy and I were so no lie. We had bought tickets to Austin we're flying out May of 2020, and then the pandemic hit, and so it's like everything got canceled.
You haven't been there?
I've never been to Austin. I've just been layover. Just that's it.
You need to go to Austin, bro. Yeah. Like the food scene is way better than like San Francisco, the Bay Area. Like that food scene is amazing, dude. I'm telling you, bro. Like you can get the most basic barbecue, and it's tops like any barbecue in California.
There's no brisket, like no good like legit brisket here. So like, you know that I mean we're tri-tip is California deal. Yeah. But I've had like brisket in South Carolina, but I don't think it's the same thing as Texas.
Texas barbecue is on a different level, bro. I'm telling you, you gotta go.
I believe that. All right, last rapid fire question here for you. You win the lottery. Let's say it's $100 million. What, aside from like the responsible stuff and like, you know, maybe getting a house, whatever, what's the first lavish thing you would spend with that? Like you got like, you know, you've got that much money. You don't ever have to worry about anything else in your life. What would be the first lavish thing you would
First buy? Lavish thing?
Yeah.
Damn. Man, that's hard.
Is there anything you've wanted, like from a collection standpoint, or, I mean, because the obvious answers is I get a few houses,
or you get a few houses,
a few cars, you know. But I'm thinking about like something that's obscure, like, you know, like a dope ass watch or something like that, or I don't know, like if there's something that I know what I would get. I would get like the most, like I don't even know which guitar I would get, but I'd get like just the most expensive guitar that I can think of, you know, collector's item or something, Jimi Hendrix guitar or something.
Damn. Yeah, I don't know, man. Like I'm into like right now, like I like these different types of things like cold plunge, like these like infrared saunas and type of stuff like that. I think I would build something like that in my own home, like just get a cool cold plunge, get like some type of red light therapy type of thing, some like cool infrared thing. I would just make it into like some wellness center. I would do like
you could afford all of it at that point.
Yeah, I would. Yeah, so I would do like a sensory deprivation tank. Like I used to do that back in the day a lot. I would go like at least once or twice a month and do sensory deprivation tanks. So like I would just get all those things, man, and just have it there in my home.
Yeah, that'd be cool. Definitely. Yeah, that'd be cool. I mean, one of your homes, you know.
Yeah, one of my homes. Yeah, just one of my homes.
the beach house resort or something.
Oh, it'll be at the beach house for sure.
Yeah. Luis, man, you've been really generous with your time, and thank you for letting me pick your brain and all these things. There's a million more things that I'm going to think about afterwards that But thank you for stopping by and talking about this. And
I enjoy what you're doing, man. There's a lot of good stuff that you're doing, and yeah, I think it's just gonna get better, man.
Yeah, I'm gonna at the obviously I'm gonna tag some of the work you're doing too. But is there anything specifically that you want to highlight or anything you want to plug that either content wise or your website? I'd love to plug all that.
Yeah, you can go to, I'm on Instagram, so it's Abbott Psych. You can go on Instagram, so I do a lot of like kind of education around mental health, or like, I like kind of like doing like, I'm trying to like bring into like these videos I'm doing, kind of bring in the different interventions that I'm doing in therapy with. So like kind of just like, almost like I'm bringing therapy into like Instagram, so like giving different people like skills and coping things when they're dealing with or what they're dealing with, and you can use to help deal with whatever anxiety, depression, trauma. So kind of my videos like that. So you go to Abbott Psych, and then like you mentioned before, I'm on Therapy House podcast, so that's on like everywhere, Apple, Spotify, you can find that there. Yeah, I have my own website. I think it's called it's Abbott, www.abbotpsych.com. You can go there and kind of just find out like kind of my private practice and kind of see the different stuff I'm doing.
That's ABBOTT, right?
Yeah, ABBOTT. Yeah, everyone kind of leaves out the T. So, but yeah, so abbotpsych.com. Yeah, that's it.
Man, appreciate your time.
Cool. Thank you. Thank you for having me.
Thanks for stopping by.
Appreciate it.